Is the oral weight medication Contrave going to be a good fit for you? Welcome to my channel. If you have questions about your weight, if you're confused about weight medications, and if you want medically based answers to your weight questions, you are in the right place. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications. I actually talk to patients about their weight. I've helped hundreds of patients lose weight, and I'm here to help you too. Today, I'm talking about Contrave, which is an oral weight loss medication. So what is Contrave? It's a combination of bupropion and naltrexone. Now, bupropion is an antidepressant, and naltrexone is actually an anti-opioid medication. What are these doing in a weight loss medication? So bupropion is thought to interact in the brain to increase the availability of some certain neurotransmitters, some certain brain chemicals, and that would be norepinephrine and dopamine. And when it does that, it's thought to decrease the appetite and decrease the food as reward pathway in the brain. And then naltrexone is also thought to interact with the dopamine pathways so that it too is really decreasing that idea of food as reward or entertainment, that circuitry that's really involved in cravings. It's also thought that it might upregulate the energy spending pathway, the kind of fat burning pathway in the brain as well. As a side note, naltrexone doesn't really seem to cause weight loss on its own the way that bupropion does. When we prescribe people bupropion as an antidepressant, weight loss is certainly one of these known side effects. But naltrexone on its own doesn't seem to cause that effect, but seems to really kind of boost the effect of bupropion when you prescribe them together. How well does it work? Well, like most oral medications, patients who take this can expect to lose between 5 to 10% of their total body weight. Who is it a good fit for? Well, provided that somebody meets the BMI requirements for a weight medication, it's going to be a really good fit for anybody who struggles with weight issues and also has depression. It's going to be a good fit for anybody who has weight issues and really struggles with cravings. And it's really going to be a good option for patients who have price constraints because both of these medications are available as generic. So let's say your insurance didn't cover this particular blend. You can work with your physician who can co-prescribe both the medications to pretty much get you the same effect, but without using the name brand solution. So who is this medication not a good fit for? So not going to be a good fit for anybody with an issue with uncontrolled high blood pressure, cardiac rhythm issues, anybody with a history of seizures or very significant alcohol issues or alcohol withdrawal. This is a no-go for you. Anybody with substance use disorder, or anybody on, chronic opioids, you cannot take naltrexone. Why bother? Just do not take naltrexone if you're on opioids. Not a good idea. If you have a history of glaucoma, not a good fit. And then also if you have a history of bipolar disorder, or history of suicidal ideation, suicidal thoughts, this is not going to be a good fit for you. So that's the deal with Contrave. It can be a really good fit for people. Also, if you're on a GLP-1 agonist, sometimes I'll also add this medication if we're not getting to the BMI that's healthy for a patient. You can add some of these oral medications and they can work really well for the right person. So it can be a great fit for some people. If you're thinking about it, definitely talk with your physician. Thank you so much for watching. As always, my references will be listed down below. If you want to work with me directly, you definitely can. I'll leave that information down below. Like and subscribe, do all the things, and please be well.